Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on rheumatic heart disease. So, what is rheumatic heart disease? Rheumatic heart disease is a heart valve damage due to rheumatic fever. The fever is your body's inflammatory response to a bacterial infection. Children in poor countries, tropical countries without access to antibiotics are at the highest risk. The condition can lead to serious health problems including heart failure. Medication and surgery are the main treatments. What is rheumatic heart disease? Rheumatic heart disease is the heart valve damage resulting from rheumatic fever, bacterial infections called as group A streptococcal GAS infection can cause rheumatic fever. An infection such as strep throat or scarlet fever triggers your body's immune response. It causes inflammation throughout the body, including in the heart. If untreated, inflammation can lead to permanent heart valve damage and serious health problems. Who will get rheumatic heart disease? Children and teenagers with untreated streptococcal infections are the most likely to get rheumatic fever. Signs of heart damage can develop years after the infection and fever are gone. How common is rheumatic heart disease? Rheumatic heart disease is rare in the US. It's more common in low income and developing parts of the world. Antibiotic for bacterial infections may not be available in these areas. About 3 lakh people worldwide die of rheumatic heart disease each year. Who is at the risk for rheumatic heart disease? People are at a higher risk for this disease if they don't have easy access to the healthcare or antibiotics, or if they have repeated streptococcal infections that go untreated, or if they live in overcrowded or unhealthy conditions or unhygienic environments. Symptoms and causes of this disease are that it may not appear until years after a streptococcal infection or rheumatic fever develops. People with heart damage may experience chest pain, fatigue, heart murmur, which is Carey Coombs murmur, and shortness of breath, swelling in the stomach, hands, or feet. And what causes the rheumatic heart disease? Heart valve inflammation from rheumatic fever causes rheumatic heart disease. The damage may occur right away, or it can develop over time from repeated streptococcal infections. Continuing inflammation lead to heart valve scarring or narrowing, and the disease tend to affect the mitral and aortic heart valves, and these valves control blood flow. If the valves do not work, blood leaks backward into the heart instead of flowing out of the heart. What are the diagnoses and tests to be done for rheumatic heart disease? How is rheumatic heart disease diagnosed? Your healthcare provider might evaluate your symptoms. He will perform a physical exam on you and reviews your health history, and especially any history of fevers or bacterial infections. And your provider may also use the following tests to diagnose heart valve disease, such as blood tests to check for inflammation or high immune response, such as CBC count, complete blood picture, echocardiogram, and ultrasound of the heart to find leaky or narrowed heart valves, and electrocardiogram (ECG) test of the heart's electrical activity to check the heartbeat. How is rheumatic heart disease being treated? There are no cure for rheumatic heart disease. Treatment can help you manage symptoms and may delay disease progress. Treatment include medication. Your provider may recommend medication to manage any abnormal heartbeat. Anticoagulants, blood thinners can reduce the risk of stroke or blood clots. And surgery. Severe rheumatic heart disease may need heart valve surgery. A surgeon repairs or replaces damaged heart valves. How is heart valve repair performed? During heart valve repair surgery, also known as balloon valvuloplasty, your surgeon inserts a catheter, thin flexible tube into a small incision cut into your leg or chest, and funnels a deflated balloon through the catheter to your damaged heart valve. Inflate the balloon inside the valve, opening it to help improve the blood flow. How is your heart valve replacement performed? If it is not possible to perform a repair, you may need valve replacement surgery. Your surgeon replaces the damaged valve with an artificial valve or a tissue valve. In some cases, your surgeon may perform a Ross procedure. The procedure swaps one of your healthy valves for the damaged valves. So, how can I prevent the rheumatic heart disease? You can prevent rheumatic heart disease by taking antibiotics at the first signs of a streptococcal infection. See your doctor, healthcare provider. If your child has chorea or fever, joint pain, muscle pain, sore throat, tonsillitis, swollen tonsils. Chorea is a jerky, uncontrollable muscle movements. What is the outlook for the people who have rheumatic heart disease? People with well managed rheumatic heart disease can enjoy a high quality of life. The right treatments may delay or prevent heart failure, but the disease is permanent and require long-term care. What are the complications of rheumatic heart disease? Rheumatic heart disease can lead to arrhythmia, abnormal heartbeat, atrial fibrillation, which is abnormal heartbeat in the upper parts of the heart that prevent a normal blood flow, which is atrias, and the heart failure. Heart does not pump blood as well it should. So any of these conditions can increase your risk of stroke or blood clots. And how does rheumatic heart disease affect pregnant people? Rheumatic heart disease is especially dangerous for pregnant people. Pregnancy increases the amount of blood in your body and your heart has to work harder to pump the extra blood. A person with damaged heart valves can have serious health issues during pregnancy and the fetus health is also at risk. When should I call the doctor? Contact your healthcare provider if you experience new or worsened symptoms including confusion, difficulty breathing, chest pain, swelling, or pain in your lower body. Rheumatic heart disease is the result of inflammation in the heart, and the inflammation is your body's immune response to an untreated bacterial infection. Over time, it damages your heart valves and disrupts blood flow. Rheumatic heart disease can lead to heart failure. People with this condition need careful monitoring and treatment. And then, what is the Ross procedure? I will tell you that the Ross procedure for aortic valve repair can help you live an excellent quality of life. It replaces a non functioning aortic valve with a pulmonary valve. A healthy donor valve replaces the original pulmonary valve. After recovering, many people live a healthy, active lifestyle for decades. What is the Ross procedure? This complex heart surgery is for adults and children with aortic valve disease. It is also known as pulmonary autograft procedure and is a type of aortic valve replacement. It involves replacing a non functioning aortic valve with your pulmonary valve, implanting a healthy donor valve where your pulmonary valve used to be. Why is this procedure necessary? The aortic valve plays a critical role in your health. It opens to release oxygen rich blood from your heart out to your body and prevents blood from going back into your heart between beats. Aortic valve disease, including stenosis, narrowing, and regurgitation leaking, can affect valve function, making you feel sick. These issues raise your risk of severe complications like heart failure and infections. How can a Ross procedure help you? With severe heart valve disease, it's necessary to replace the non functioning valve using your own tissue, maximizes long term valve function. People who undergo a successful Ross procedure maintain a quality of life similar to people without heart disease. There are no restrictions on physical activity. You are also far less likely to experience heart failure. Why replace the aortic valve with a pulmonary valve? The Ross procedure involves using a healthy pulmonary valve to repair the aortic valve, and this approach is uncommon but ideal because the aortic valve is under high pressure. A durable replacement ensures long term valve health. Prosthetic valves are more sensitive to early degeneration and blood clots might occur, and replacement using your natural tissue help you avoid these risks. And then the pulmonary valve is not under high pressure and it's similar in size and shape to the aortic valve. The pulmonary valve position can better tolerate degeneration of a donor valve. Who is eligible for a Ross procedure? You may benefit from a Ross procedure if you are younger than 60 years old and have congenital aortic stenosis, a narrow aortic valve at birth, other types of aortic valvular disease, or aortic valve endocarditis. Who is not eligible for Ross procedure? People with certain conditions are not good candidates for this procedure. These conditions include autoimmune disease such as lupus and rheumatoid arthritis, connective tissue disorders such as Marfan syndrome, coronary artery disease in three or more arteries, pulmonary valvular disease. So, these are the persons in whom this procedure is not being done. What happens during a Ross procedure? The Ross procedure takes many hours to complete. Here's what happens. You go under general anesthesia, which puts you to sleep and temporarily blocks sensation. You will also have no memory of the procedure. Doctor placed you on the heart lung cardiopulmonary bypass machine, and this makes it possible to safely stop your heart, and cardiopulmonary bypass takes over work of your heart and lungs during the procedure. Surgeons make an incision down your chest and separate your breastbone sternotomy to access your pulmonary and aortic valves. They inspect the pulmonary valve to ensure it is healthy enough to replace the aortic valve. Surgeons remove the damaged aortic valve and replace it with the pulmonary valve, and next they implant a healthy donor pulmonary valve. With the new valves in place, surgeons restart your heart and slowly take you off the heart lung bypass machine. They test the aortic and pulmonary valves to ensure they are working properly. To complete the procedure, surgeons put your breastbone back in place and secure it with wires. They close the incision with stitches and protect the area with a surgical dressing. The Ross procedure begins with the measurement of the aortic and pulmonary walls. Next step in the Ross procedure is to open your aorta and pulmonary artery. Your surgeon carefully inspect the valves to determine if the Ross procedure is appropriate. In the Ross procedure, your surgeon removes your diseased aortic valve, then they remove the pulmonary valve and move it over to the aortic position. Then your surgeon attaches a pulmonary homograph, donor tissue, to the outflow tract of your right ventricle as a part of the Ross procedure. Finally, the surgeon performing your Ross procedure attaches your aorta to the autograft, formerly your pulmonary valve, and the pulmonary artery to the homograph donor tissue, and your procedure is complete. What are the benefits of a Ross procedure? This procedure offers many benefits such as ability to live an active lifestyle including regular exercise and driving, the ability for women and people designated female at birth DFAB who wish to become pregnant to do so safely, and excellent blood flow throughout your body, hemodynamics, and no need for lifelong blood thinners that are typically necessary with other treatments, and quick symptoms relief. Many people start feeling better shortly after surgery. What are the risks of the Ross procedure? This complex surgery has many risks. Receiving care from an experienced heart surgeon who will perform a high volume of Ross procedures lowers the likelihood of complications. Ross procedures complications may include abnormal widening of the aorta near the new valve, aortic autograft dilation, and arrhythmia, heart attack, hemorrhage, infection, leaky heart valves, narrowing of the new aortic valve, pulmonary allograft stenosis. What is recovery from a Ross procedure like? After surgery, you wake up in the cardiac intensive care unit ICU, and you may need a ventilator to help you breathe. A heart monitor provides real time assessment of heart function. You can expect to stay in the ICU for up to 5 days. The recovery continues at some time at home and can last several months. During this time, it's common to experience constipation, depression, insomnia. Will I need more treatment later in life? After a Ross procedure, you will need lifelong monitoring to test valve function. A replacement pulmonary valve is not meant to last a lifetime and typically need replacing within 15 to 20 years. Regular monitoring ensures you receive a timely replacement. Healthcare providers often use minimally invasive techniques for this procedure so that you can expect a quick recovery. When should you contact your healthcare provider undergoing a Ross procedure? Contact your healthcare provider if you experience signs of complications such as bright red stools, chest pain, coughing up blood, dizziness or lightheadedness, fever or chills, tingling sensation in your hands or feet, unusual bruising or bleeding, vomiting. So the Ross procedure offers a lifeline to people with severe aortic valve disease. It replaces the aortic valve with your pulmonary valve. A healthy donor valve replaces the pulmonary valve. After a successful procedure, many people enjoy a renewed sense of health and hardly any activity restrictions. For the best results, it is important to receive care from an experienced heart surgeon who has performed a high volume of Ross procedure. What is the heart valve surgery? Heart valve surgery repair or replaces a valve that's too narrow or doesn't close right. Valves need to work efficiently to help blood flow the right direction through your heart. Heart valve surgery options include open, minimally invasive, or through veins access to your heart. It takes 1 or 2 months to recover depending on the surgery. Heart valve surgery fixes or places one or more of your four valves in your heart. Your valves located between your heart four chambers keep your blood moving the right way. When valves are working right, your blood flow should flow through your heart in one direction each time your heart beats. Valves act like doors that open and close with each heartbeat, letting blood flow in and out of the chambers. When a valve is not working right, some of the blood may go back to the chamber or room it just left. Other times, a valve may become narrow, which may prevent blood from moving forward. This is a problem because it keeps your heart from working efficiently. Your four heart valves are tricuspid, lets oxygen poor blood flow from your right atrium upper chamber to your right ventricle lower chamber. Then is the pulmonary valve, lets oxygen poor blood move from your right ventricle lower chamber to your pulmonary artery, which takes blood to your lungs to get oxygen. Then is the mitral valve, lets oxygen rich blood coming back from your lungs move from your left atrium upper chamber to your left ventricle lower chamber. Then the aortic valve lets oxygen rich blood move from your left ventricle lower chamber to your aorta, which sends blood to your entire body. What are the types of heart valve surgery? The two types of heart valve surgery options are valvular repair surgery to fix the damaged or faulty valve while preserving much of the person's own tissue. The mitral valve is the most commonly repaired valve, but repair surgery can treat problems with the aortic and tricuspid valves. Valve replacement surgery to remove the faulty valve and replace it with the biological pig, cow, or human tissue or mechanical valve, metal or carbon valve. All valve replacements are biocompatible, and which means your immune system would not reject your new valve. You will have tests so your healthcare provider can find out the location, type, and extent of your valve disease. The test results help determine the best type of procedure for you. Other factors your doctor will consider are your heart structure, your age, other medical conditions you have, and your lifestyle. Your cardiac surgeon can combine valve surgery with other heart surgeries. Examples include surgeries that involve more than one valve procedure and combining valve surgery with bypass surgery, aortic aneurysm surgery, surgery to treat atrial fibrillation. Can a heart valve repair itself? No, a heart valve cannot repair itself. Valve disease does not go away. It gets worse with time. As the disease gets worse, you will more symptoms and your overall health will suffer. These changes often happen slowly, but they can also occur very quickly. Depending on the type and extent of the valve disease you may be able to take medications for the short term. Surgery is the only effective long term solution, and your healthcare provider will help determine whether it's time to pursue that option. When is heart valve surgery necessary? You may have been born with a valve problem or developed a leak, a stiffness, or narrowing in your valve. You will most likely need treatment for heart valve disease if you are having symptoms like chest pain, difficulty breathing, and fainting or dizziness. While medications can help improve your symptoms and quality of life, surgery is the only effective long term option. Ask your healthcare provider when you should start considering heart valvular surgery. You may have a chest x ray, echocardiogram, electrocardiogram the day before your surgery. Other tests might include a CT scan, heart cath, and lab test. A healthcare provider will shave and clean the area where your surgeon will be working. Don't eat or drink anything after midnight the day of your surgery. Check with your healthcare provider about the medication you can take before surgery. Bring loose comfortable clothes and shoes that are easy to put on, and if you wear a bra you may want to bring one that's easy to put on without raising your arms. The persons who brought you to hospital can hold on to these items for you during surgery. What happens during heart valvular surgery? You will receive medicines through an IV in your arm or hand so you can sleep deeply and painlessly, and your healthcare provider will use the smallest incision that can for your surgery. Your surgeon may have a machine take over for over heart and lungs during surgery. Depending on which surgery you are having, your provider will repair or replace your heart valve. Heart valve surgery options include traditional open heart surgery, an incision which is 6 to 8 inches through your breastbone, and minimally invasive heart valvular surgery, a smaller incision, 3 to 4 inches or smaller. Techniques include endoscopic or keyhole approaches, also called a port access, thoracoscopic or video assisted surgery, and robotic assisted surgery, and transcatheter. Your provider will put a catheter into a larger artery, such as your femoral artery, into your groin and do the work without making a cut in your chest. After surgery, your healthcare team may move you to an intensive care unit where they can monitor you closely. After that, you will be in a regular room. You may be in the hospital for 5 to 7 days. Machines connected to you will monitor your blood pressure and heart rate. You may have tubes coming out of your chest to drain fluids. Your provider will encourage you to eat, drink, and walk as soon as you can. After surgery, you can start with short walks around your room or down the hall and increase your distance little by little. Your provider may sign you up for cardiac rehab, a carefully monitored exercise program. Heart valve surgery can ease your symptoms, improve your life expectancy, and help prevent death. The potential advantages of heart valve repair versus valve replacement are lower risk of infection, less need for lifelong anticoagulant, blood thinning medications such as aspirin or clopidogrel, valve surgeries including valve repair and valve replacement are the most common minimally invasive procedures. The benefits of minimally invasive surgery include lower risk of infection, less bleeding and trauma, shorter hospital stay, shorter recovery. Any surgery involved that is heart valve surgery risk may include heart attack, heart failure, abnormal heart rhythm. You may need a pacemaker, stroke, infection, and bleeding. Risks related to your age, other medical conditions you have, how many procedures you have in a single operation. Your cardiologist and surgeon will talk to you about these risks before your surgery. If you have a valve fixed or replaced, you may be at a higher risk of getting infective endocarditis, but this can also happen with a faulty valve that is not repaired. In certain cases, your healthcare provider may prescribe antibiotics to keep you from getting endocarditis from some type of dental work. You can reduce the risk of endocarditis yourself by taking good care of your teeth and having benzathine penicillin regularly monthly. How long does it take to recover from heart valve surgery? It takes about 4 to 8 weeks to recover from heart valve surgery, but your recovery may be shorter if you had minimally invasive surgery or surgery through a vein. The way you feel after surgery depends on which valve was repaired or replaced, your overall health before the surgery, which method your provider used to get you to your heart, larger incision, smaller incision, or through a vein, how the surgery went, and how well you take care of yourself after surgery. You can expect to get tired easily for the first 3 weeks after surgery. Don't drive for a few weeks after surgery, and don't handle anything that weighs more than 15 pounds for the first 6 to 8 weeks after surgery. What is the survival rate? After following the heart valve surgery, a study found that people who were more physically active in the year after surgery had a lower risk of death than those who did not exercise much. The death rate ranged from 0.1% to 10% depending on the operation and the person's overall health. So contact your doctor if you have chest pain near your incision. If you feel depressed, this can happen after surgery and can make you recover take longer. And you have a fever, which can be a sign of infection. And you can gain, if you gain more than 5 pounds weight, which may mean you are retaining fluid. Medication often help during the first stages of the valve disease, but they don't work as well as the disease gets worse. You don't need to wait until your symptoms become unbearable before you have surgery. In some cases, it's best to have surgery before symptoms start. The decision to have surgery is a major one that's based on your individual needs. It involves input from you, your cardiologist, and your surgeon. Yes, a heart valve replacement is considered major surgery, however, it may seem less intimidating if you have a minimally invasive type of surgery, which is common. The amount of time your valve repair or replacement lasts depends on several things according to your age, whether you have heart valve repair or replacement, type of the valve you have placed, or for heart valve replacement. Mechanical valves rarely wear out, but they may need replacement if a blood clot, infection, or tissue growth keeps them from working right. Biological valves may need to be replaced, especially if you are younger. The need for anticoagulant medication, blood thinners after surgery depends on the type of surgery you have. The medication prevents blood clots from forming and causing problems with your heart valve. Currently, warfarin is the only approved blood thinner for mechanical heart valves. If you have a mechanical heart valve, you will need to take this medication for the rest of your life. If you have valve repair or biological valve replacement, you may need to take this medication for several weeks after surgery or may not be at all. You may need to take an anticoagulant for a condition not related to your heart valves. This medication also treats an irregular heartbeat, an enlarged heart, a weakened heart, people with a history of blood clots. After talking with you, your surgeon will choose the best option for your heart valve surgery. Once you will know what type of surgery you will have, you can rely on your family and friends to help. You may not be allowed to bend and lift after surgery for a while. Ask people to help you with housework and meal preparation so you can focus on recovery. You can also prepare and freeze meals before your surgery so you can just reheat them while you heal. So this was all about rheumatic heart disease and about the heart valve surgery that might be needed in rheumatic valvular disease. So I hope so that this topic would be more informative for you. And if you have liked this video, so please kindly share this video with other individuals as well. And have a wonderful nice day. And don't forget to subscribe my channel. Thank you very much.